Hey, East Central Illinois EMS, this is Dr. Bloomstern with another treatment tip. We're looking today at the non-transport protocol for those patients suspected of having coronavirus or COVID-19. In your protocol manual, you'll see that it is titled Emerging Infectious Disease Non-Transport for Suspected COVID-19. This is the layout of the protocol that you see here. At the top, you have your three boxes that you're used to with our new protocols: the history, the signs and symptoms, and the differentials. The key here is the signs and symptoms here in the middle box. Those patients that might have a fever greater than 100.4, those patients that might have a cough, shortness of breath, nasal and or chest congestion, sore throat, body aches and or fatigue, or anybody with nausea, vomiting and or diarrhea may be a candidate for this protocol. First things first, we start off with this orange box here at the top. Does the patient meet COVID-19 criteria? If they do, then we continue. If they do not, then we need to follow the appropriate protocol in our protocol manual. If it does meet COVID-19 criteria, first and foremost, we need to remember that we have our full PPE on, meaning we have N95 mask, gown, gloves, and goggles. We want to try to limit patient contact to one provider if at all possible. Again, if they meet COVID-19 criteria, we're going down into the second blue box here. This is our patient assessment. If the patient meets all of these criteria, we feel that they may be appropriate for non-transport and or stay at home. First, they need to be less than 60 years of age. Their temperature needs to be less than 104 degrees Fahrenheit. Their respiratory rate should be between 8 and 20. Their pulse ox must be greater than 94% on room air. Their heart rate needs to be less than 110 beats per minute. Their blood pressure systolic needs to be greater than 100, and their Glasgow Coma scale needs to be 15 and no signs of altered level of consciousness. If they meet all of these criteria, then we're going to continue down our pathway to the continued assessment box. If any of these criteria are not met or they fail any of these criteria, then we go over to the right and we treat the patient appropriately with the appropriate protocol and transport that patient to the receiving facility of their choice. Again, if they meet all of these criteria, we're going to go down into the second blue box here into our continued assessment. These are additional signs and symptoms that we need to be looking for in these patients. Does the patient have chest pain and or chest discomfort? Does the patient have any signs of respiratory distress or severe shortness of breath? Is there any diaphoresis or cyanosis? Did the patient have any syncopal type episodes? And is the patient immunocompromised or have any poorly controlled comorbidities such as lung disease, heart disease, renal disease, liver disease, diabetes, and or pregnant? If they have any of these, then we need to treat the patient appropriately and transport to the receiving facility. If they do not have any of these criteria, then we're going to continue down into the very last box here, which means that this patient is a candidate to not transport to the hospital and to stay at home. Again, the patient must be willing to do this. And so if we have met all these criteria, we need to ensure first and foremost that the patient has medical decision-making capacity and agrees with the non-transport. If at any time the patient wants to go to the hospital, then we should transport them appropriately and accordingly to our protocols. We need to educate the patient on the possible risks associated with transport and non-transport options in order to make a sound decision and an informed decision. We need to encourage the patient to stay home if they meet all of these criteria and self-monitor for signs and symptoms related to the coronavirus or COVID-19. We need to ensure that the patient has appropriate support systems, somebody to care for them, and a means to contact us back if they need us, such as a cell phone or a telephone to call 911. We are going to leave our COVID-19 patient handout with the patient that gives them all the signs and symptoms and treatment techniques to utilize at home before leaving. We're going to encourage them to call us back utilizing 911 if their symptoms worsen. And we want to encourage them to contact their primary care provider and or the health department to make them aware. All of these patients need to be ran through medical control. We're going to contact medical control to discuss the situation with the online physician and get clearance with that physician with the medical control. And then finally, what we're going to do is we're going to have the patient sign the IDPH form, which is Patient Agreement for Non-Transport During COVID-19 Pandemic. We are also going to fill out a refusal form as we normally will and fill out the appropriate patient care report that your system or your agency utilizes. Again, this is just an example of a non-transport. They must meet all these criteria and we must ensure that the patient has a good support system, is able to call 911, has a means to contact their primary care provider, and is also, the biggest point, is agreeable with staying at home. This is just an example of our non-transport form. If you have any questions, please contact our office. Otherwise, we'll be looking out for more videos and treatment techniques related to the coronavirus and COVID-19. For the time being, it's Dr. Bloomstrand with East Central Illinois EMS.